Doctor, welcome. Introduce yourself and give us your
you.
testimony.
Thanks for having me this morning. My name is Dr. Angelina Farella, and I am a pediatrician in Webster, Texas, independent solo physician. I have come here today really to protect our children of Texas. This is a very scary situation that we're in right now. I just want to kind of touch on a few things, some history. Never in history before have we given medications that were not FDA approved to people that were not initially studied in the trial. There were no trial patients that were under the age of 18. There were no trial patients that were previously exposed or had COVID. These are two very important points with this. The other issue is safety. I'm kind of a safety freak. I'm a pediatrician. I've been a pediatrician for over 25 years. I find myself a vaccine expert. I've given tens of thousands of vaccines in my office. I am not an anti-vaxxer. I'm a very pro-vax, actually, except when it comes to this COVID vaccine, if we can call it that. One of the big issues is the safety profile. The safety and the adverse events recommendations through the ACIP, which is the Advisory Committee of Immunization Practices, they have made some recommendations in regards to the COVID-19 vaccine. One of the things that is extremely troubling, and it's on their ACIP guideline for the Pfizer vaccine in particular, that recommendations about safety and adverse events will come out after authorization. After authorization. This is a very scary issue. We find out data on safety before we subject our patient population to this. We are currently allowing children 16, 17 years old to get this vaccine, and they were never studied in this trial. On top of that, these kiddos, they're extrapolating the data from adults down to children and adolescents. This is not acceptable. Children are not little adults. Not acceptable at all. Children have a 99.997% survivability from the COVID. 99.997%. Let me repeat that for you all to understand. And there's evidence that these children are actually a buffer. What that means is that these children actually, for some reason, do not spread the disease. Children are not super spreaders. So what we're doing to our kids right now is actually criminal. We are isolating them. We are putting them in masks, which is also clinically dangerous. We are also telling them that, psychologically telling them that if they bring COVID home, they're going to kill grandma, granddad, aunt, uncle, mom, and dad. That is a horrible, horrible situation to put on our kids. Let me go back to the rotavirus vaccine of 1999. I've been in practice long enough that I actually was giving rotavirus back in 1999, and it was pulled off the market then because of 15 cases of intussusception. Intussusception is where the gut telescopes on itself. Intussusception is not necessarily life-threatening. It sometimes self-reduces, but the rotavirus vaccine was actually pulled immediately, and we stopped giving it to our kids. And what has happened with this particular vaccine is appalling to me. We have in excess of 4,000 deaths, and this thing has not been pulled yet. This is absolutely unacceptable. On top of that, a few years ago, maybe some of you don't understand that we had a flu epidemic, pandemic in 2017, and it killed 95,000 Americans. And 95,000 Americans died despite the fact that we have early, effective antiviral treatment for the flu. Okay? We now have early, effective outpatient treatment for COVID. We've had it for a long time. As a pediatrician, I stepped up to the plate in Texas to help Texans, adults, because doctors in my community shut their doors, locked their doors, and refused to treat patients. I've seen hundreds of adults active COVID. I've also treated post-vaccine problems in adults. This is, again, me stepping up to the plate. I'm becoming very vulnerable because as a pediatrician, this is not my wheelhouse, but my wheelhouse is infectious disease. I see lots of little kids. They are petri dishes. The reason why they're a buffer is exactly that reason. They have something called a thymus. A thymus helps them with T-cell immunity. So that's another point for you to understand. Thank you for allowing me to speak.
Doctor, thank you. Senator Lucio has a question for you, Senator.
Of the people that you stated have died because of influenza, what percentage of those people had that early,
Early effect, like Tamiflu or amantadine or other
I
antibiotics.
mean, were these people that died that didn't have any kind of medication?
Well, that's a very interesting question because the way the influenza is recorded, it is not an actual reportable disease in some counties, states. So the national numbers through the CDC are estimates, but we know that it's available.
I understand that, but you see, you led me to believe that they had died, even though there's availability to that
Correct.
medicine. But you led me kind of to believe in your presentation that they had died, even though some of them had taken.
I'm sure there were some that did take it. Yes, there's high risk individuals that we can only do so much.
Well, we don't have
But there's no data.
statistics or anything.
Correct.
Are you here testifying for yourself or for your profession, your pediatricians, let's say, of Texas?
Myself.
Yourself. Okay. Thank you.
Thank you, Senator. Any other questions for the witness? Senator Hall.
With your experience, you're talking about going back to 1999 or maybe before, has there been another vaccine that had the high incidence of serious hospitalizations and deaths that this vaccine is now showing?
Not to this extent, absolutely not.
Not even,
This one,
not even close.
close. Not even close.
Any other vaccine would have been pulled from the market.
Absolutely. It would have been pulled probably within the first few, just
Right.
as we've seen in the past. What was it?
And have you seen any other vaccine that was put out for the public that skipped the animal test?
Never before,
Skipped,
especially for children.
and what I've read, they actually started the animal test, and because the animals were dying, they stopped the test.
Correct.
Folks, I think that's important to understand there, that what we're talking about is the American people are now the guinea pigs. This is the test program that's going on. They didn't do the human testing, and they stopped the animal test because the animals were dying, and then they turned it out for the public. And we are now looking at businesses that want to mandate that this experimental vaccine be given to people as a condition of their employment. And yet we have this death count that continues to rise and be totally ignored out there. So, do you agree with what I was saying, Doctor?
Absolutely.
Okay.
Absolutely.
Thank you very much. Appreciate you and your work.